ሰላም ቤተሰቦች ፕሊዝ ኮፒ ሊንክ ሼር ሰብስክራይብ እያደረጋችሁ ለብዙ ሰዎች እንዲዳረስ አድርጉ። ቪዲዮአችን እየታየ አይደለም። በተለይ ጥርና ታህሳስ ላይ የምትፈተኑ ኤግዚት ተፈታኝ ነርሶች ፕሊዝ እነዚህ ቪዲዮዎች በጣም ነው የሚጠቅማችሁና እናንተም እየተጠቀማችሁ ለሌሎች ሰዎችም እንዲዳረስ ኮፒ ሊንክ ሼር ሰብስክራይብ አድርጉ። በእርግጠኝነት የምነግራችሁ ይሄንን ቪዲዮ ሳታዩ ይሄንን የቲክቶክ ቤተሰብ ሳትሆኑ ወደ ፈተና እንዳትሄዱ በጣም የሚጠቅማችሁ ወሳኝ የሆኑ ጥያቄዎችን ነው ይዘንላችሁ የመጣ ነውና እነዚህ ጥያቄዎች እንዳያመልጣችሁ ሁላችሁም ኮፒ ሊንክ ሼር ሰብስክራይብ እያደረጋችሁ 10 ጊዜ ሪፖስት እያደረጋችሁ ለብዙ ሰዎች እንዲዳረስ አድርጉ። CC Nursing Exit and COC based multiple question for nurse part 3 prepared by Lishan Tio. So question number 1. A client with atrial fibrillation who receiving a maintenance therapy of warfarin sodium has a prothrombin time PT of 35 seconds and an international normalized ratio INR of 3.5 seconds. On this base of this laboratory value, the nurse anticipate which prescription? A. Adding dose of heparin sodium. B. Holding the next dose of warfarin. C. Increase the next dose of warfarin. D. Administering the next dose of warfarin. So the correct answer for question number 1 is B. Hold the next dose of warfarin. Question number 2. A client is receiving a continuous intrainfusion heparin sodium to treat deep vein thrombosis or DVT. The client activated partial thromboplastin time or APTT is 65 seconds. The nurse anticipates that which action is needed for the patient. A. Leaving the rate of heparin infusion acid. B. Discontinue the heparin infusion. C. Increase the rate of heparin infusion. D. Decrease the rate of heparin infusion. So the correct answer for question number 2 is A. Leaving the rate of heparin infusion acid. Question number 3. A client with diabetic mellitus has a glycosylated hemoglobin A1C level are 9%. On the base of this test result, the nurse plan to teach the client about the need for which measure? A. Avoiding infection. B. Taking inadequate fluid. C. Preventing and recognizing hypoglycemia. D. Preventing and recognizing hyperglycemia. The correct answer for question number 3 is D. Preventing and recognizing hyperglycemia. Question number 4. A client brought to an emergency department state that has accidentally been taking 2 times his prescribed dose of warfarin for the past week. After noting that the client has no evidence of obvious bleeding, the nurse planned to take which action? A. Prepare to administer antidote. B. Draw a sample for type and cross-matching and transfuse the client. C. Drawing sample for an activated partial thromboplastin time or APTT level. D. Draw a sample for prothrombin time PT and international normalized ratio INR. So the correct answer for question number 4 is D. Draw a sample for prothrombin time PT and international normalized ratio INR. Question number 5. A client has just undergone insertion of a central venous catheter at the bedside under ultrasound. The nurse would be sure to check which result before initiating the flow rate of the client intravenous solution at 100 ml per hour. A. Serum osmolarity. B. Serum electrolyte. C. Chest radiography result. D. Intake and output record. So the correct answer for question number 5 is chest radiography result. Question number 6. When a 15 years old female patient admitted an emergency ward on red color zone, secondary to status asthmaticus, for this patient, an emergency health team start to give care, but which one of the following treatment is not correct? A. Administer bronchodilator every 20 minutes. B. Administer oxygen as needed to prevent hypoxemia. C. Perform nebulization every 6 hours per day. D. Every drug start with high dose. So the correct answer for question number 6 is D. Every drug start with high dose. Question number 7. The main symptom of a disease is the development of sudden or insidious onset of dyspnea and a family predisposition with the deficiency of alpha-1 antitrypsin. Based on the above data, what is your diagnosis? A. Bronchial asthma. B. Pulmonary emphysema. C. Bronchoectasis. D. Hospital acquired pneumonia. So the correct answer for question number 7 is pulmonary emphysema B. Question number 8. Which kind of leukemia they affect all age group? Which kind of leukemia they affect all age group? A. Chronic lymphoblastic leukemia. B. Chronic myelogenous leukemia. C. Acute lymphoblastic leukemia. D. Acute myelogenous leukemia. So the correct answer for question number 8 is D. Acute myelogenous leukemia. Question number 9. Nurse Solomon is a senior professional nurse that works ex-General Hospital in medical ward. He has transfusion blood for post-operative patient. But the patient develops severe unwanted reaction after this complication of blood transfusion was stopped. A doctor orders CBC result. The results show that severe low hemoglobin. Based on the above data, which kind of anemia most commonly the patient develop? A. Aplastic anemia. B. Hemolytic anemia. C. Nutritional anemia. D. Pernicious anemia. So the correct answer for question number 9 is hemolytic anemia. Question number 10. The last question for part 3 nursing basic exam COC exam. Please like, share and comment and subscribe. Please ለሁሉም ሰው እንዲዳረስ like, share, subscribe እያደረጋችሁ ለብዙ ሰዎች አዳርሱልን። Question number 10. A 25 years old male patient come to urology facility at emergency ward with a complaint of chest pain, secondary to mild physical activity with a shortness of breathing. During history taking, he took a beta blocker for hyperthyroidism. The vital sign is normal except pulse rate 45 beats per minute. Based on the above data, which drugs are very important to treat this problem? A. Propranolol. B. Atropine sulfate. C. Albuterol. D. Digoxin. So the correct answer for question number 10 is B. Atropine sulfate.